right, so that's the view from the current administration, the current health secretary, and the FDA commissioner. Tonight we pick up and get the other side of the debate. Joining us now is Dr. Amesh Adalja, senior scholar at the Johns Hopkins University for Health Security. Great to have you here, doctor. So let's just begin with Florida first, and then we'll get to COVID. Florida becoming the first state to end all vaccine mandates. The Florida Surgeon General said today that, quote, every last one of these vaccines is wrong and drips with disdain and slavery. He then went on to say, who am I to tell you what your child should put in their body? Isn't that what public health officials actually do?
What the Surgeon General of Florida has said is basically the exact opposite of the truth. What we want are people to partake in safe and effective vaccines to allow schools to actually be able to educate, to prevent disease outbreaks from occurring, to increase immunization levels against diseases that have hospitalized kids, that have killed kids. So what Dr. Ladapo is advocating is the exact opposite. And it's basically a pander to the anti-vaccine movement, using such kind of inflammatory language, comparing it to slavery. What we want are our children to be safe and healthy. And these vaccines that schools should have the right to require as a condition of entry have really kept us safe. And when we see those rates go down, we get what we see now. Yeah. Record-breaking measles outbreaks.
Well, Florida just had a big measles outbreak last year, and measles, we know, is one of the most transmissible viruses on the planet. Some pediatricians have quickly condemned this move in Florida, saying measles will come roaring back and other infectious diseases will follow.
That's exactly true. We've already seen it. We've already seen measles come roaring back. We've had 3 deaths from measles in 2025 in the United States. That's really unacceptable. We will see outbreaks of pertussis. We're already seeing, even without what's happening in Florida, we're seeing the rates of vaccine exemptions increase, which then just makes our schools tinderboxes for the spread of viral infections. And this is something that we're going to have to face for the next several years.
I want to get your reaction to what we were talking to Dr. McCary about last night. And this was President Trump calling on drug makers to make public their data on COVID vaccines. President Trump said, I've seen all this data that shows the vaccines worked, but the CDC is being torn apart by the debate on vaccines. The FDA commissioner was on last night. He said, we have not had updated data on the COVID vaccine in a randomized controlled trial. He also said that we have broad immunity and we don't need the vaccine anymore. What do you make of his argument?
Well, just full disclosure, Dr. McCary is a friend of mine and a former colleague at Johns Hopkins, and I do respect many of his views, and I think he is a scientist that knows how to navigate these problems. But what I would say is that everybody can see how beneficial the COVID-19 vaccines have been, especially in those with high-risk conditions. It's critical for keeping people out of the hospital and keeping people from dying. Where there may be needs for new data might be in low-risk populations to see, is there a benefit in lower-risk populations? But in high-risk populations, the data is incontrovertible, and I think Dr. McCary would agree with me in high-risk populations. And yes, we do have broad-based immunity, but COVID still kills tens of thousands every year.
Dr. Amesh Adalja, thank you so much. Really, really appreciate you coming on tonight.
Thanks.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.